We created the North Carolina Institute of Medicine Legislative Health Policy Fellows Program back in 2018 after talking to several of our partners in other states who have similar programs. We talked to partners in Georgia, South Carolina, and elsewhere about the need to have a program that really helped connect state legislators with data and information that would help them make health policy decisions in the state. The Legislative Health Policy Fellows Program aligns with the greater mission of NCIOM because what we do is we bring people together to talk about the challenges in our state and to talk about the solutions to those health policy challenges.
I really didn't know what it was going to be like when I signed up for it, but what I really enjoyed about it is building the relationships. I've met a lot of people that have given me insight into what they're doing and hopefully give us some better decision making on what we do in the state of North Carolina.
So we have people who are new to the legislature, we have people who are more senior in the legislature, we have people from both parties, we have people from both chambers, and they're really able to come together and talk about these issues.
I want to join the Legislative Health Policy Fellows Program because we're learning more about how the impacts of physical and mental health are having on North Carolinians and policy, and I really wanted to learn directly from the source. So I think there's two things that make the North Carolina Health Policy Fellowships really stand out. The first part of that is you're really engaging with folks who are leaders in this policy space. And then that kind of leads into that second aspect where you're talking to folks who are living these experiences in North Carolina, who are dealing with different aspects of health, medicine, and policy issues and practical issues on a daily basis. So that really helps formulate your ideas on what you want to do as a legislature.
It's a very focused agenda. They pick a subject, they bring in multiple people to talk about it. I think they try to keep the politics out of it, so that they're not discussing what maybe the Republicans want or what the Democrats want. It was really neat because, one time I might be sitting beside another Republican, but then the next time I'd be sitting between two Democrats, and we developed those friendships and bonds. And I'm big on civility and statesmanship. I think we all need to display that, and everything in the meetings was always handled like that.
We understand that there are so many things that go into people's ability to be healthy. Their access to education, their access to health services, things in their community like transportation and food. And by connecting legislators with agency leaders and experts across all of these fields, we're really hoping to deepen their understanding of the ways that all of their policies make an impact on people's health.
I'm a lawyer by trade, and I can look at a bill and I can read it, but I don't really fully understand how it's going to affect somebody in the medical profession or insurance and all those things. And this program really does give me a different mindset.
So back in our first cohort in 2018, we had brought a philanthropic leader to talk to the group of legislators. One of the legislator participants said, I used to think that as a legislator, I didn't really have a role in people's health because I thought that so much of it was about people's choice in their health behaviors. But this conversation has really helped me see that I do have a role as a legislator. I can do things like help a community build a sidewalk. I can do things like help a community have better access to healthier food.
If a fellow legislator was thinking about joining the program, I would encourage them to do so.
It makes us better policymakers. I think that's the whole idea of this, is we want people that are introducing bills, voting on bills, establishing the policy of North Carolina. I want those to be the best educated and the best informed folks. Every member of the legislature should go through this program or a similar program.
In the beginning, we had our cohort of legislators, and since then, we now have every other year an additional class that is made up of legislative staff as well. We really try to build a conversation with those staff members about what are the things that they're hearing from their constituents, what are the needs in their district when they answer the phone in their office. So what's next is we continue to expand these resources. We've already had more than 80 legislators who participated in the program, and we hope to continue to build on that number. We also hope to continue to build the resources that I mentioned. So continuing to build our data, continuing to build various connections with experts in the state that can help inform the policymaking process as well.